Start that right away. Okay, and we should be ready to go. All right, here we go. If anybody else, oh wait, hang on. We've got 3 people in the waiting room. I knew that would happen as soon as I said it. Okay. All right, back to our show. Thank you everybody for joining. It's been a while since we've had a media briefing. I'm Phil Bridges with UNC Health Communications. Logistics, you know how Zoom works. We will be recording. We'll make the audio file available. We can email that one after the fact if you need it. And then we will also have the video, which we will upload to YouTube. So, and those will both be unedited. So it's just like you were doing it yourself, not a problem. So let me know. So there's been a great deal of interest in recent weeks and recent days on double masking and the importance of mask fit during the COVID-19 pandemic. Our experts have looked into it and they've conducted some original research that we're going to share with you today, and just wanted to let you know about that. One thing also we want that kind of piqued our curiosity too is we have a video from one of our presenters that was recorded some time ago, and up until last week it had about 6,000 YouTube views. And as of the, hang on, Richard Stradley needs to get in, okay. As of this morning, that 6,000 view video has 186,000 views. It was put onto the CDC website and gained a lot of popularity from that. So that's Emily Sickler Bennett, who Alan will introduce, and she can tell you about that later. So we'll jump right in, and so I'm going to hand it over to my colleague Alan Wolf for introductions of our experts today. Alan?
Thanks, Phil. Good morning, everybody. We have some really incredible researchers on this call who can help us understand a little bit more about mask research and where things are headed. Dr. Emily Sickler Bennett is Director of Infection Prevention at the UNC Medical Center and Associate Professor of Infectious Diseases at the UNC School of Medicine. Dr. Philip Clapp is an aerosol toxicology expert in the Center for Environmental Medicine, Asthma, and Lung Biology. Assistant Professor of Pediatrics.
Hang on one second here. Somebody needs, if you could put yourself on mute there, that way we won't get the feedback. Okay, go ahead, Alan, sorry.
Nope, it's all good. Dr. Sickler Bennett, I'll kick it over to you and let you get started. Thank you for joining us.
Thank you, good morning. As Alan introduced me, I'm Emily Sickler Bennett. I'm the Director of Infection Prevention at UNC Medical Center. Infectious disease epidemiologist. I'm really happy to join you today to talk about our experience with masking over the last year. So as you know, last spring when the COVID pandemic began, the US really had very little experience with mass masking for the whole public for infection prevention purposes. Among the public, it was generally believed that your mask was more to protect others than to protect you. That is, the masks were best for containment of your own aerosols. Although in the hospital setting, for infection prevention purposes, masks have always been a regular strategy for protection in interacting with patients who have communicable diseases like tuberculosis, influenza, and pertussis. So we had, while the overall benefits of masking was really well established, there was really a missing amount of data that helped us inform us a little bit more about the efficiency of different types of mask and understanding some of the details about fit and things like that. The other really significant experience from last spring is that from the hospital and healthcare environment, we were really experiencing a critical shortage of available mask options. And that led us to this really unique partnership between the hospital and the UNC and EPA aerosol scientists at the Center for Environmental Medicine and Lung Biology. This was actually a really natural partnership for me. My father, William Bennett, serves as a professor of medicine and is one of the lead researchers there. So when I expressed to him some unease at prioritizing what our face mask options were during the pandemic, the aerosol team got together and really approached this problem very systematically and scientifically, and they helped us measure the fitted filtration efficiency. So that is how well masks protect us from others, so that we could prioritize our options available to us. We first studied sterilized respirators, expired respirators, respirators with exhalation valves, respirators from other countries that were approved by CDC and those not approved by CDC. And then following that work, the team evaluated some effectiveness of masks that are available to the general public, cloth masks, and improvements to the simple ear loop mask, as referenced in part by the YouTube video that is now circulating. So now the team has expanded on that work even further to assess improvements in fitted filtration with double masking. So I'd like to turn it over to Dr. Clapp to introduce some of the work to you.
Sure. Let me make sure I'm actually off of mute now. Okay, so yeah, my name is Dr. Philip Clapp. I'm an assistant professor in the Department of Pediatrics and also an inhalation toxicologist in the Center for Environmental Medicine, Asthma and Lung Biology. And as Dr. Sickler Bennett said, we've put together a collaborative team here at UNC with the EPA investigators in the EPA Human Studies Facility to look at the efficacy of face pieces and masks for the COVID-19 pandemic. We were excited to do this work initially when the hospital reached out to us to address the immediate need for UNC Healthcare to prioritize their masking within the facility. But we realized when we started doing this work that we could also inform the public for community masking. So we've been looking at all kinds of masks, everything from consumer grade and commercial masks to ways to modify your mask to improve it, to provide added benefit to the wearer. And as Dr. Sickler Bennett said, over the last couple of weeks, there's been an increased interest in double masking, and we hadn't done any of that kind of work previously. So now we've moved our operation to do a lot of that kind of research and to understand whether just stacking masks together actually provides an added benefit for the wearer, or if there's different combinations like a procedure mask over a cloth mask or vice versa, which would actually give you the best fit. So I'm happy to share some of that preliminary data. As I said, we've been doing this now, mask testing, for almost a year. And as these things pop up, we try to address them immediately. So this is very new to us as well. We hadn't tried double mask testing until just a week ago. But I'm going to share some of the data from just one subject that we've tested so far. We're doing other studies, and these will continue to come out over the next couple of weeks. So I can go forward and go ahead and give you a little information. First, it may be useful for some of you that haven't followed the work that we're doing here to know a little about how these studies are done. So I'll tell you a little bit about the chamber and the setup that we're using to do this kind of testing. So as I mentioned, we work in the EPA Human Studies facility here on UNC's campus. And this study facility typically studies environmental pollutants like wood smoke. So they bring subjects in and they expose them to different environmental pollutants, and we do kinds of measurements and toxicology studies here. But during the pandemic, these studies have been on hold, and we were able to repurpose the chambers in this facility to actually do this sort of mask testing. So we take a chamber, a 10-foot by 10-foot stainless steel chamber, and we fill it with small particle aerosols. And these are salt crystals that are roughly the size of COVID or SARS-CoV-2 virions. So we pump this chamber just full of these particles to really increase the concentration. And while the chamber's filling, we'll pick different masks that we're interested in testing. So this is just one of the examples. So a standard ear loop procedure mask that we've been looking at recently. So in order to understand how well it functions, the first thing we have to do is install a sample port on the front of the mask. So this is just a small metal sample port. And then we have a member of the research team actually wear the mask. So they'll put the mask on just like this and then enter the chamber where there's a high concentration of particles. So we connect to the sample port a piece of tubing that goes to a condensation particle counter. And that's a piece of sensitive equipment to measure aerosol counts, so particle counts as they're getting into the breathing space. So the subject is standing in the chamber. There's lots of concentration of particles around them. They're wearing a mask, and there's a sampling that's happening within their breathing space. So while the subject is in the chamber, we have them undergo a series of range of motion tests, and that includes bending at the waist, talking out loud, looking left and looking right, and looking up and looking down. And what you can possibly appreciate from this video is that as I'm turning my face and talking, you're seeing gaps open up on the corners of the mask and at the nose. And so with the concentration of particles in the air, as we're introducing gaps, particles are flowing through these gaps or even through the material in some cases with masks. And we can detect that on our particle counter. So it gives us a really nice way to measure the concentration of particles that get through this and into the breathing space from the outside air. So what we've seen with double masking in the last couple of weeks has been quite interesting. I had my skepticism about whether it would actually benefit to have two of these masks, one over the other, because you're not really addressing fit. And what the data that we've generated so far has shown is that you really need to address fit and make sure that whatever you're wearing is tight to your face to get the most benefit out of the material. So with the double masking, we actually saw about a 15% increase in the overall fitted filtration efficiency. And that's the filtration efficiency as the mask is worn and undergoing these tests. So about 15% increase by just double masking surgical mask or procedure mask over procedure mask. But we were also curious as to whether you could alter that and the filtration efficiency by stacking the procedure mask with a cloth mask. So we did it both ways. We put the procedure mask over the cloth mask and the procedure mask under the cloth mask. So with the procedure mask on top, you still had the issues of not really having a great fit around the edges of the procedure mask. And that only increased efficiency by about 10% over what the cloth mask alone was providing. But if you did it the other way and you put the looser fitting procedure mask below your tighter fitting cloth mask, you actually can see quite an added benefit. We saw in some cases as much as a 40% increase in the fitted filtration efficiency by putting the surgical mask or procedure mask under the cloth mask, as long as the cloth mask was fitting tight to the face. And I know that there's been a lot of controversy over gaiters and the use of gaiters in recent months. But the gaiter actually performed quite well in these studies because it's tight to the face and it's a sleeve kind of design where it goes all the way around the head. So if you put a procedure mask under that and you use that to pull the procedure mask very tight, the gaiter went up by about 40% effectiveness as well. We've also looked at mask frames, which aren't intended to be used with double masking, but essentially form a tight seal around the edges of your mask. And even with a single mask in that case, using a frame or a brace, we saw an increase of 30 to 40% just with a single mask. So that's a kind of a summary of the data as it stands at the moment. And I know that was kind of quick running through everything, and I'm happy to answer any specific questions about that.
So yes, well, thank you so much. And we would like to open it up for questions. Any questions for Dr. Clapp or for Dr. Sickler-Bennett or for both? So just please jump right in. We don't have a formal process here.
This is Anna Rivera from ABC 11. Can you guys kind of just summarize, yes, it is more effective if you wear two masks, or no, it's not? Just kind of summarize your findings in general, because once you get in the weeds, it just can be a little confusing. So what would your guys' suggestion be overall?
I'm happy to start, and I'm sure Dr. Clapp has some to add to it. I mean, I think the most important thing for everyone to remember about masking is that the most effective masks are going to be ones that everyone is wearing. So step one, everyone should be wearing a mask that fits over their nose and mouth. And that fit really matters, as Dr. Clapp said. And we did show that just improving the fit on a single mask increases 20% of its fitted filtration ability. So a 20% improvement in just making some simple fixes to a single mask that you have. Beyond that, there are advantages if you're concerned and want to get even better filtration, that some of the variations that Dr. Clapp described could even improve it further. But first and foremost, double masking in the form of you and the person you're interacting with both having a mask on is the most important double masking there is.
So I agree completely. The data that we're sharing at this point shows that there is a benefit of double masking in terms of the fitted filtration efficiency. But I think, as Dr. Sickler-Bennett was saying, and as I was trying to illustrate a few minutes ago, the fit is key. So what we know about these procedure mask is that the material is very effective. There have been a lot of filtration studies looking just at the material, and it's upwards of 90% effective at filtering airborne particles. So it's a very effective piece of material. The problem is that they don't fit well to your face. So before you would concern yourself with double masking, I would say it was important. It's very important. And what we do in my home is I check my wife when she's wearing her mask, and I actually check my 4-year-old daughter when she's wearing hers. So if you have someone that can check to see the gaps around your face, that's the way that you can get the most immediate benefit from even a single mask. Beyond that, if you've already done that step, you can't expect to get a slight bump in the filtration efficiency by adding a second mask on top of it.
Hi, doctors. This is Josh Zach at WPTF in the North Carolina News Network. I had a question about the procedural masks, and in particular, perhaps the manufacturers or the brands that people buy, because when we see these things in the store, they could range in price, and sometimes people might opt to say, I'll get this 10-pack for $2.99 because this 50-pack is $50. They don't want to spend the money. Is there a difference? Is there a product people need to avoid?
You want me to take that, Emily, or you want to?
Sure. Yeah. You can take that one.
Okay. So I wish I had a better answer for you than what I'm about to say. And that is that it's been really hard for us to tell or even predict at all how well a mask is going to function. And we've tested, for these studies, we've looked at 5 different brands of surgical masks. And even within a box, I've compared them side by side, and some are slightly longer than others. Some ear loops are slightly longer than others. And if you have variations in either the length of the mask or the ear loops, they're going to fit differently from one mask to the next. So we've seen the filtration efficiency range as they're worn from 30% upwards to 80%, depending on how tight it fits. And it doesn't seem to be consistent between manufacturers. I will say that the construction of these masks vary, and you'll see different types of certification. So ASTM certification indicates that's more of a medical grade surgical mask or procedure mask, and it's got splash protection. These are typically 3-layer masks, and the inner layer is a polypropylene layer, and that's a very protective layer. So if you can find a mask that has that kind of construction, a 3-layer with an inner layer polypropylene core, that could be beneficial.
I do have one follow-up on that, and it's on the topic of masks, but off the topic of the particular surgical mask. We see the KN95. How does that differ from the N95?
I'm happy to start, and Dr. Clapp, you can add to this. This was one of the things that we tested actually in our first set of experiments. These are foreign manufactured masks that are designed to be almost to the same level of respirators like we use in the US. But what we found in our early studies is that they do definitely perform very differently depending on how they're constructed. And so they are not necessarily an equivalent for N95s, and some of them performed more similarly to an ear loop type medical procedure mask as opposed to a respirator.
Sure, and I can add that the KN95, it's a type of standardization and testing that different countries have different standardizations and methods for testing their respirators. And really, when you get into something with a designated number, a 95, a 99, something like that, you're going beyond a mask and you're into the respirator realm. So when they give you a number that it says you're going to reach this level of efficiency, that's a respirator. And in order to reach that kind of criteria, they have to be tested. So KN is the Chinese testing standards that they go by. We use NIOSH N95 here. In Europe, it's the FFP. So you've seen all of these passed around the community and in the news. They've all got different standards. The interesting thing about the KN is that they can have ear loops, and there are no NIOSH approved N95s with ear loops. And the reason is that head straps provide such a tighter fit that you get the benefit of the filtration medium once it's really tight to your face. And the problem we've seen in our testing with KN95s, there are some, CDC has shown that there are some that are coming in that the filter medium itself is insufficient. But if we have some that are actually a good filter medium, it's a matter of keeping the mask tight to your face. So the problem is really with keeping it tight to your face.
Hi, this is Jason DeBrune with North Carolina Public Radio. I've got a question, and sorry if you already clarified this, but one of the main benefits of the masks we know is to others, right? I mean, we wear the mask so that we don't spread the virus. In this double masking, are you seeing this increased benefit specifically for yourself? So even if I'm in the grocery store, say, and other people are, whatever, doing the chin strap method or something like that, am I increasing the protection to myself by double masking, or am I mostly just increasing, the protection to the people around me?
Yeah, so just to clarify, the methods that the aerosol lab is using is directly measuring the protection for you, the protection that you receive by being around others. They're simulating this environment with sodium chloride aerosols as if you are experiencing aerosols from someone else. And so these figures are directly representing how much you are protected from other people.
Yeah, thank you, Jason. That's a good question. And we're doing, we're actually trying to start testing the flip side of what we've been doing. And that's how well are masks functioning at containing while they're being worn. And it may not seem intuitive, but that's a much larger ask scientifically, because you have to be able to capture everything that's coming out of the wearer and be able to sample from that to understand exactly what's getting through the mask and getting around the mask. So we're doing that testing now, and we hope to have some information on that within the next couple of weeks or months.
Hi, this is Judith with CBS 17 News. My question is, we talk about these N95s and they're very hard to get right now. Is there any kind of combination of double masking that gets you anywhere close to that kind of protection?
You want me to take this one?
Sure.
Yeah, thank you, Judith. So as I said, the filter medium itself for these procedure masks, they're quite effective. And we've had our collaborators at the University of Alberta in Canada test these masks, and they're ranging between 90 and 98% effective in terms of just the procedure mask, just the material itself. So it really comes down to fit. If you can find a way to make the mask fit your face, you're going to get the most benefit out of it. We haven't seen, except for under one scenario, a surgical mask or a procedure mask reach the threshold of an N95. We have seen several reach upwards of 80 to 90% effective while being worn. The one that we saw that reached 95% is actually about 97% effectiveness, was double masking surgical masks and then putting a frame or a brace around the face to hold everything down. So we were guaranteed there were no leaks and you had the benefit of 2 layers, and we got to about 97 or 98%. But generally speaking, we haven't seen any kind of double masking configuration, or whether that be procedure on procedure or a cloth over procedure, that would reach that threshold.
And I'll just add, it's important to understand that these measurements that we're reporting out are for sodium chloride aerosols. And so what we don't know is how much of the SARS-CoV-2 we actually need to filter out in order to prevent infection to ourselves. And that's really, that's really the key. From an epidemiology standpoint, we have many instances, studies and investigations where individuals have been symptomatic in common areas, and when everyone around them is wearing all different varieties of cloth masks, surgical masks of all types, there is no transmission. So while we are, trying to achieve the best filtration that we can, and we can measure this very specifically with a non-infectious mechanism, we don't know that level is really needed to prevent SARS-CoV-2. And in fact, the epidemiology data is very reassuring that even these lower masks are very effective for this purpose.
I will add briefly one other point, that we have actually looked at double masking over and under an N95. And that's not something that we're recommending. The N95 respirators, the ones that are certified by CDC NIOSH, have a breathability rating. And as people that have worn these for extended periods of time would attest, it's definitely difficult to breathe through these masks for extended periods of time. So if you start layering things over a mask that's already hard to breathe through, you're really going to strain your breathing. It's not going to be something that is really sustainable, and it's going to likely result in people wanting to remove their mask more often. So there may be some benefit for double masking in certain scenarios, but if you start to reach instances where the breathability becomes a major problem, then it goes back to what Dr. Sickler Bennett said: the best mask is the one that you'll continue to wear.
Hey, all, this is Will Michaels from WUNC. Can you remind me what the baseline was? You said, for instance, that a surgical mask underneath a cloth mask represented a 40% improvement in efficiency, but what over what?
Yeah, hang on, I'm just taking a glance at the data here. So the cloth mask itself, it's typically been measured for us around 40% effectiveness, and that varies from mask to mask. Some fit more tightly, some have more layers. So the cloth mask is about 40% effective. The surgical mask that we've been testing is also around 40% effective. So we're seeing about a 40% increase from that.
Hi, this is Shelby Polk with North Carolina Health News. I hate to even ask this question, but we still get comments on every story about masks. Are you seeing a decrease in oxygen or anything like that with double masks?
So neither Dr. Clapp or I are medical doctors, so we are probably not the best source for that. But from all of our medical doctor colleagues that have reported out on this, and there's some, I know, links on UNC Health's news about this as well, that is not believed to be a concern.
I can add from just the science perspective of this. If the concern seems to be from people are worried about rebreathing their own air, and if you rebreathe your own air, there's an increase in carbon dioxide and a reduction in oxygen. The thing is that when you're wearing a mask like this, the volume of air inside of this breathing space is very low. So when I take a breath in, I'm pulling in air from the outside, and really that's what we're talking about, protecting ourselves from the particles in this air on the outside. So you're bringing in fresh air in addition to the small amount of air that you've exhaled previously. So we don't believe there's a concern there, but as Emily said, that's really more of a medical question, but the science doesn't really support that.
I got a question.
All right, well,
to me.
Oh,
Could
go
I
ahead.
ask
Sorry.
a quick question? No, it's okay. I think one question top of mind for a lot of people is just when will we be able to stop wearing masks, particularly as more vaccinations happen, more people get their second doses in the coming weeks and months. Can we count on ditching the masks at some point?
Mm-hmm.
Yeah, I think that is a really important question on everyone's minds. I mean, over the last year, masks have become probably one of the most important, if not the most important strategy behind vaccination. COVID is transmitted by respiratory droplets, and masks are key because they protect us from others, they protect others from us, they protect our nose and mouth from our potentially contaminated hands, inoculating our nose and mouth. So they serve really three important key purposes. And by everyone wearing masks consistently, I think that's the best way that we're going to end the pandemic. And when transmission slows and is relatively uncommon, then we'll be able to reassess as a community when it's time to stop wearing masks. But I think we have shown in many settings when they are used consistently how important they can be in really stopping the spread.
We're about out of time here, but I did see Lynn Bonner had a question. If I could get to it, I can't get my chat to open back up. You can see her question there.
Just with variants showing they're more easily transmitted, should we be wearing masks outside?
Yeah, I mean, I do think that this, concern about variants being transmitted more readily is one reason why people are looking at improvements on their masks. And so thinking about some of these new lessons we've learned about ways to improve the fit, or potentially double masking would be ways to better prepare us if we do have more transmissible variants in the future. And certainly if you're outside in a space where you're in close proximity to others, we would definitely recommend mask wearing in those settings.
Well, thank you everybody for joining us. We've already run over a little bit. We greatly appreciate you taking time to be here today. Thank you so much, Dr. Sickler Bennett and Dr. Clapp. We'll make these files available. If you just need the audio file for radio folks, we can email that to you, and we will upload the video to YouTube and try to get that out very shortly. Thank you all so much and have a good day. And that ends our media briefing.